Hi everyone, so today we'll be speaking to you about the different modalities used in imaging the prostate gland. But first, why do we even use medical imaging and what's its purpose? So, ideally medical imaging encompasses different modalities and processes to image anatomical structures within the body. Three major reasons are for diagnostic and treatment purposes, as well as being frequently used in follow-ups of disease that have already been diagnosed and or are being treated. So moving on to the fun stuff, the prostate. Now, this is a firm, muscular, glandular body located at the base of the urethra. Its entirety is not actually one gland, but rather made up of a number of tiny glands. And between them are tissues containing bundles of smooth muscles. It has two main functions, the first being the control of urine, and secondly, it also secretes a milky fluid that is taken into the urethra when a man ejaculates. We image the prostate ideally to treat and diagnose anything irregular. These abnormalities in men consist mainly of prostate enlargement, which is also known as BPH, and prostate carcinoma. BPH is a benign, non-life-threatening growth in comparison to prostate cancer. Tests such as a digital rectal scan may miss some cancers, while prostate-specific antigen tests may cause issues of over-treating these benign tumours as a result of high PSA levels. So imaging such as MRI, ultrasound, CTs and biopsies are all modalities mainly used to identify size and stages of prostate lesions, which in turn is used to implicate correct treatment plans. Transrectal ultrasounds are a widely used clinical imaging method, as well as an essential imaging tool for prostate cancer biopsy guidance. Transrectal ultrasounds involve a probe or a transducer inserted into the rectum at high-frequency sound waves. Images of the prostate and seminal vesicles are shown through the bouncing back of sound or differences in acoustic impedance. Images are recorded in a transverse and sagittal plane. However, transrectal ultrasounds on their own correspond to a digital rectal scan's accuracy and both complement one another. So, if a doctor felt a lump or an enlargement, then the ultrasound would show this, however provide no information in regards to its composition or stage if it were to be cancerous. This is because some palpable cancers are not visible and some visible cancers aren't palpable. However, the guidance of a biopsy needle by ultrasounds provide a clinically better diagnosis and therefore adequate treatment. And to take these biopsies, a very fine needle is guided using images from the ultrasound screen through the wall of your rectum into the prostate, and a sample of tissue is taken. It is known to be one of the best imaging modalities because it's the only technique that provides a histological analysis of prostate tissue. Therefore, they can also differentiate whether they are benign or cancerous lesions. However, there are substantial flaws in terms of determining the size, shape, stage, volume, and even the aggression of the cancer. The modality is often found highly invasive. This is due to the fact that the more specimens taken, the more pain received by the patient. Studies have shown that transrectal ultrasound-guided biopsy have a low sensitivity, ranging from 39 to 52%, and a high specificity, which is approximately 80%. And so because of a high false negative rate, repeated biopsies are often necessary. This is also to obtain a wider range of the prostate specimens, as often biopsies may miss tumours. This leads to symptoms such as rectal and urethral bleeding, increased chances of urine infection, as well as the presence of blood in one's semen.
Computed tomography is an X-ray which uses a computer to create a 3D image of the prostate gland and is used in the imaging of prostate cancer. It is essential to provide information about metastatic disease, which is the spread of the cancer from the original tumor location. It is not very useful in diagnosing prostate cancer, but is useful in detecting enlarged lymph nodes in later stages of the cancer and in cases of reoccurrence. CT imaging is most important for the staging of metastatic disease. It is recommended that CT should be performed only in patients with a PSA level greater than 20 nanograms per milliliter or clinical tumor stage T3 or higher. This is because the criterion for detection of positive nodal disease at CT is based on node size, and nodal enlargement due to metastasis occurs relatively late in the progression of the cancer. Targeted imaging with CT scanning can be helpful in diagnosing osteoballistic, osteoskeletal, and soft tissue metastasis in the body. In terms of clinical approval, it is recommended to only have the CT scan done if medically required. CT imaging can assist in identifying an enlargement of lymph nodes, which are usually an indication of metastasis in the bone or tissue. Using CT, detailed images of the body are produced, which allows more body organs to be viewed in greater detail. Cons include X-ray radiation exposure to the patient. However, as stated before, this is not significant enough to show proven detrimental effects. In comparison to MRI, CT does not provide high contrast images, which can lead to missed detection of cancer in lymph nodes. It is also not the modality which provides the best view of the prostate gland as a
Now we move on to magnetic resonance resolution. MRI is one of the most rapidly developing methods in regards to prostate imaging. It utilizes the use of radio waves which are passed through and used to emit hydrogen atoms that naturally exist within the body. As hydrogen atoms return to their usual orientation, they transmit energy that varies due to the type and section of the body tissue from which they come from. The MR scanner captures their energy and creates an image of the tissue scanned based on this information. A magnetic field is produced by moving an electric current through wire coils in MRI units. A computer then processes the signals and generates a series of images, each of which show a thin slice of the body. There are many benefits to using this type of modality when detecting and diagnosing prostate cancer. This includes not being exposed to ionizing radiation, which is used by methods previously discussed, being non-invasive, and soft tissue of prostate and pelvic structures are clearer than all possible methods in prostate imaging. In contrast, the inability to distinguish cancer tissue from inflammation within the prostate glands, leading to incorrect diagnosis, is considered to be the main downfall of MRI technology. Of MRI is on its way of providing a better outcome to prostate cancer images. Many faults are present in the technologies today, and a way to fix this is by improving current techniques. Scientists are on their way of developing a new version of MRI called multiparametric MRI. As its name suggests, the imaging type will encompass many parameters when observing the prostate, all at one time. These include T1-weighted imaging, which helps differentiate post-biopsy hemorrhage from the actual tumor, tackling the problem previously mentioned, T2-weighted imaging, which provides high-resolution images of the prostate's anatomy, dynamic control enhanced imaging, which will be used to provide information to plot a region of interest against time to create a curve. There will be 3 types of curves, each coding for different conditions of the prostate tissue. With this development comes many more, including MR, ultrasound fusion biopsy, which merges both MR and ultrasound images to guide a biopsy needle more accurately.
After looking at some of the recent advances in the field of imaging, we have highlighted some of the many technologies on the horizon that will further enable rapid and effective diagnosis, staging, and follow-up of prostate cancer. With new modalities for visualizing prostate cancer, we are better than ever before able to characterize and localize lesions, and we are learning how to apply these capabilities to improve treatment decisions and more effective follow-up. With further research in the area and technological advancements as well as awareness, hopefully one day we will be able to effectively contribute to long-term outcomes for prostate cancer.